Welcome to New Hampshire's Business. I'm Fred Coker. If there's one big positive from this pandemic, a takeaway from this pandemic, it's our nurses, who in most cases have gone beyond the call of duty trying to save lives at the risk of their own. Which leads me to put a spotlight on a college-hospital partnership in New Hampshire that aims to reduce the significant shortage of nurses in New Hampshire and other healthcare professionals. And it is Dartmouth-Hitchcock Colby Sawyer College Partnership. Up to $3.2 million Dartmouth-Hitchcock investment in Colby Sawyer. Colby Sawyer implementing new health science programs to help fill 1,000 plus total Dartmouth-Hitchcock healthcare job vacancies, which includes around 150 nurse jobs. And also this, some Colby Sawyer faculty are based at Dartmouth-Hitchcock. That's unique. 80% plus Colby Sawyer nursing grads go to work at Dartmouth-Hitchcock. And Colby Sawyer is expecting 95 to 100 first-year nursing students this fall. With me, there, the president of Colby Sawyer College, Sue Stubner. Welcome, Sue.
Thank you.
And Chief Human Resources Officer at Dartmouth-Hitchcock, Amy Claiborne. Welcome to you.
Thank you.
This is a 40-year relationship between the college and the hospital, I understand, but now has been accelerated. Amy, I would guess, based on the numbers I've seen, the acceleration at Dartmouth-Hitchcock is partly due to the shortage of nurses. Just talk about that.
Yeah, we've had a longstanding relationship with Colby Sawyer College. Dates back to actually 1981 when Mary Hitchcock Memorial Hospital Nursing School closed and Colby Sawyer became our nursing school. So we're really proud of the partnership that we had over the years. And we endeavor to hire the nurses that come out of Colby Sawyer, given the quality of clinical care that they deliver. And they're also trained right here in our own environment. And so the partnership really made sense to us to expand upon that, to say nationally and regionally, we're experiencing such a nursing shortage. Is there an opportunity to not only increase the number of nurse graduates, but also to expand other health sciences fields of where we really see difficulty hiring?
Yeah. So this partnership, is it working for Colby Sawyer in terms of more students in the nursing and health sciences? In other words, has it boosted enrollment?
Absolutely. A year ago, we had about 60 students incoming for nursing at the undergraduate level. For fall 20, we saw that number rise to 95 students for nursing just at the undergraduate level. But we've also added 5 new undergraduate programs that have attracted students. And then we've also seen tremendous growth in our professional learners, both at the associate degree level, as well as at the Master's of Science in Nursing level. So it's definitely have a very positive impact on enrollment here at Colby Sawyer.
Here's a question for both of you. Given what's happened in the pandemic with this desperate need for nurses and technicians and administrative help as well, what else has to be done to generate what hospitals and clinics need going forward? Start with you, Sue.
I think we need to continue to address the pipeline for sure. I think that we'll see not only a number of retirements in years to come, but just burnout from this pandemic. And so one of the great things about this partnership is that we are building a pipeline to fill the need and the gap that I think we'll see only intensify in the years ahead in terms of nurses in our region.
Amy, same question.
Yeah, I think that the pandemic is highlighting for us the need for nurses and other clinical staff. Barriers to employment like housing, affordable childcare are some creative measures that we need to take to say, how do we get people to come and stay in our state and develop roots and really work in our organizations for the long term?
My thanks to both of you. Sue Stubner, who is president of Colby Sawyer College in New London, and Amy Claiborne, who is the Chief Human Resources Officer at Dartmouth-Hitchcock in Lebanon. All too short, but you made some good points. Thank you.
Thank you, Fred.
Thank you.